Welcome to Canine Wellness Online. Today is the 5th part of a series on My Dog is Limping. So first of all, let's talk about what is pain. So what is pain? The dictionary definition of pain is a perceived unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. So basically, it's a protective device that alerts the body that something might be dangerous or that there might be a problem. So to understand pain, there are sort of two modes of pain, and many of you have heard of this. There's acute pain, and then there's chronic pain. So acute pain would be somewhere where, let's say, your dog steps on a rock and hurts his foot. And basically, it's a short-term pain. It can last for a day, 2 days, to even a couple of months. And basically what happens is there's what's called a noxious stimuli. So if Ben stood on something and he hurt his foot, there's a message that goes up and it goes into the spinal cord. It's processed through something called the dorsal horn. I don't expect you to know that. And then it travels up the spine to the brain. And then the brain says, what is this experience? Oh dear, I think we have some tissue damage. And it sends another message down via some transmitters. And this is called the efferent pathway. And basically what happens is it sends a message down, back down through the spinal cord, and then back down. And then you get that, ow, my foot hurts. So that is acute pain, and as I mentioned before, it generally dissipates relatively quickly. Now when we talk about chronic pain, we think of dogs that may have some back issues, or more specifically, some osteoarthritis is a very good example. Chronic pain is when the spinal cord, or this dorsal horn, gets overwhelmed with information. So basically, with a dog with arthritis in its hip, for example, the pain is coming up and it's going to the brain, and then the brain is saying, oh my gosh, we've got a lot of input here, I don't know what to do with this. And basically, chronic pain is something that just doesn't go away unless we treat it with something, whether it be medications, and I'm going to get more into that towards the end of the video. So basically, chronic pain is more of an achy pain. It's not sharp like acute pain, like when you cut your finger. And basically with chronic pain, what happens is your body's getting overwhelmed and other tissues start to become involved because the pain is kind of building and it's not going away. So the last type of pain I want to talk about, which is common in our senior dogs, is something called neuropathic pain. And basically neuropathic pain means that there's some sort of lesion or something in the spinal cord or in the nerves coming from the spinal cord, that maybe a nerve is pinched or is being irritated by something, and it's sending a message via these nerves saying, ow, we've got pain, ow, we've got pain, ow, we've got pain. So if we were to look at this in this little model, we see we've got the spinal cord. And inside the spinal cord are all these bundles of nerves, and between each vertebrae, these little nerves come out, and each nerve tells muscles what to do, legs what to do, depending on what nerve it is. And when I'm talking about neuropathic pain, specifically, one of these nerves may be squished a little, and for lack of a better term, it's like it's can't breathe. And so what we can get with neuropathic pain is sometimes it's like a burning feeling. Anyone who's had sciatica knows what that feels like, or anyone with an iliopsoas issue. That's another burning pain that you can get, and it's coming from the lower back in humans. Well, dogs too. The other thing with neuropathic pain is if you have a dog that, let's say he's licking his front paw. Now, it might not be neuropathic pain, but very often neuropathic pain causes pins and needles. So you know, if you have your arm in a funny position for a while and you start to get that tingling feeling, and then you start to shake your hand out. Well, with dogs, they can't do that, or they don't do that. So what can happen is you see a dog licking a specific spot. So when I see older dogs or even dogs that have been injured or have some sort of spinal trauma, sometimes I'll see an area, especially if it's a white fur, you'll see it's kind of pink. And I know that they've been licking that one area. Now, obviously you have to rule out, is there an issue in that particular area, or is it coming from the nerves? And on my last video, I showed you how to do some little simple tests to check their back to see if there's any kind of pain in their back area. What happens if we don't treat pain? So basically what happens if we think of chronic pain and all these signals coming up to the brain, it's like the brain kind of gets fried. It's getting too much input, and so it's no longer the pain coming from the brain to the area that is painful gets overwhelmed. And it just doesn't know what to do with the information anymore. And what we call this is something called wind-up. Basically what's happened is all these nerves are kind of overexcited, they're hyperactive, and they're just kind of firing away. It's kind of like fireworks going off. And the body just doesn't know what to do with it. And because it doesn't know what to do with it, it can make the whole body feel painful and achy. Because the brain is just sending out signals everywhere. And this type of wind-up pain is very, very hard to deal with conventional medications. So you really want to make sure that you don't get to that spot of wind-up pain. The last thing that can happen is something called sickness syndrome. And the reason I bring this up is I have many clients that really don't want to use medications because they're worried that it might affect their liver or kidneys. So I often say to my clients, if we take medications and you're worried about the liver, let's say, being affected, like something like Medicam, we can always take something like milk thistle. Milk thistle is a liver support, and that can help the liver process the toxins from the medications. Because if we don't use medications and we get sickness syndrome, we're affecting the organs anyway. So I hope you enjoyed this series, and please like and subscribe, and I will see you at the next video.